Seasonal affective disorder, or SAD, is something we hear that affects adults when it starts to get really cold, you haven't seen the sun for a while, or it's been cloudy. It can also, though, affect children earlier in the season. Doctors say SAD affects about 10% of adults.
But for kids, it's far less, around 3 to 4%. But in the Pacific Northwest, those numbers can often be higher. And Tadevika Kaprikian shows us how kids are affected by SAD differently than adults and what parents can do to keep depression out of the winter season.
What a tackle! What a tackle!
Falling back with the time change this week means afternoon soccer practice for these Seattle kids is now under stadium lights.
It's kind of hard to play.
11-year-old Claire Schmidt says the seasonal changes don't affect her game much, and she plans to stay active all winter long.
Indoor soccer, I'm doing skiing. I'm starting skiing this year.
The Schmidt family moved to Seattle from sunny Georgia a few years ago. Mom, Mary Catherine, says the gray Seattle winters have been an adjustment. She keeps a calendar full of family activities to keep depression out of the season.
The holidays help. Traveling helps to see family, celebrating holidays certainly helps, and then keeping them enrolled in some type of activity where we're doing indoor soccer, we'll move into basketball, and then we'll start gearing up for softball as well. So just keeping them both in sports to keep them active and wear them out.
Waiting for practice to end, Samantha Ang says parents can set a positive example as the weather changes.
Enjoy the weather with them, because if you're not inclined to go out, then they're not going to be inclined to go out. So just go out with them and have fun and enjoy it together.
At Pacific Medical Center, Dr. Ari Gilmore says children are more resilient than adults and don't tend to experience strong mood swings with seasonal shifts. He says parents should look for symptoms like low energy, oversleeping, irritability, and poor school performance that are temporary.
That it really has to have that component where the onset is a bit after the daylight hours are getting less, and then it has to resolve on its own the following season as the days become longer. So you have to watch it for a while, and oftentimes it's more the second or third time it's happened where all of a sudden you realize there's this component that goes along with the seasons.
Gilmore says staying active and being social are easy ways parents and children can enjoy time together and ease effects of the gloomy days ahead.
Being social is big. Scheduling play dates, getting together with people, having dinner parties, things like that, most definitely. You have to kind of keep it going.
In Seattle, Tadevika Kaprikian, Q13 News.
And light therapy, that's helpful for adults who deal with seasonal affective disorder. Doctors say it is just as effective for kids, so maybe worth a try.
Yeah, they say getting light that's close to resembling daylight and exposing yourself to it as soon as you wake up is shown to be the most effective. So you need a day just like today every single day, and it would be okay.
You know, if you can just get a little bit of sunshine, right?
I talked about
fill up.
when we came into November, one of the first things I did on November 1st